So what will commonly happen, again, because we're always in movement, what will commonly happen is I will sacrifice stability to get mobility. And so what will start to happen is, as I'm sitting at that computer, let's say typing for a longer period of time than I normally would, that my forearm muscles aren't conditioned for, one of two things will start to happen. Most commonly, I will start to get a tendonitis. And it might be something that just causes me some stiffness and some soreness, or it might actually progress to a point where it starts to cause me pain. But when I start to sacrifice stability to get mobility, I will start to develop problems. And that's typically where things like tendonitis and bursitis come from. They come from the tissues being overworked. They aren't conditioned and strong enough to do the function of stabilizing the elbow so that I can just type. And what will start to happen is, as I'm typing, my arms start to move. And that movement, again, is coming because I'm not getting the stability that I need. I start getting excessive tension and pulling on that muscle in my forearm, and I'll start to get that ache and that stiffness there. And if I do it day after day, I'll start to develop that tendonitis. The same is true for a shoulder tendonitis or a hip tendonitis or bursitis or back problems. So again, stability is the most important thing that allows us to be mobile. As a physical therapist, we will see a patient who's coming in having problems moving. I can't throw a baseball, I can't swim, I can't run, I'm having pain tucking my shirt in, my back hurts if I sit too long or if I try to change positions, but the problem is always coming from a lack of stability. So as expert physical therapists here at Loudon Sports Therapy Center, we're going to evaluate you, we're going to evaluate your spine, we're going to evaluate your shoulder, basically the whole component of your body, and look for areas where you are not stable the way that you need to be. As a physical therapist, we are trained in how the body should move and being able to evaluate and assess how it actually is moving. Figure out where the issues are for lack of stability, how that's affecting the movement that you're trying to do, and then devise a treatment plan that is specific for you. Every back problem is not treated the same. Every knee problem not the same. Every elbow problem not the same, because each of us have different stability issues that are going into that. Expert physical therapist here at Loudon Sports Therapy Center, we're going to use our manual skills. We're going to evaluate what needs to be done from a stability standpoint. We're going to establish that stability, and as that stability starts to improve, then we can start to work on helping you to be mobile and do the things that you want to do. So if you're having any problems, whether it be pain or stiffness or soreness anywhere, whether it be problems with moving, doing regular things during the day, reaching into the dishwasher, reaching into a cabinet, bending over to tie your shoes, or something more advanced like being able to run faster, being able to throw faster, being able to kick a soccer ball further, whatever it might be, all of those things come down to you need a lot of stability. Chances are way more than you have to improve the quality of the mobility that you're looking to get.